Hello everybody and welcome back to this week's vlog. Now this week I'm going to do something which isn't very long, well it could be, the list is long, but it's something that I've been asked to do by one of my patients. So I saw a patient a few weeks ago who didn't actually think they had any menopause symptoms or perimenopause symptoms, and so I took them through a very long list of the different things that could be happening, and they were absolutely astounded that actually they had 20 different symptoms that were on the list. So from that conversation, she then went away and spoke to friends, and they didn't know either all of these different things which can be caused by perimenopause or menopause. So she said, why don't you do us a video, a vlog, and just talk through the many different symptoms? And so that's what I'm going to do today. That's really why, because it's when I see patients, in the main, they don't know, and as a GP we literally have 10 to 15 minutes to go through everything, and it can be hard. So it can be quite good if women are armed before they come with all of the different symptoms so that they know what they might be asked or what they need to tell us. And I'm going to put a link to a list of a symptom checker in the description afterwards so that women can actually do that. They can go to their GP with a list, and that's actually really helpful. As a GP, trust me, it's helpful. It's not a pain. So it's clear that women are suffering from symptoms that they don't know are menopause, and doctors quite often don't know that symptoms are menopause. And some women may get all of these symptoms, and there are up to 40 of them, and some may get none at all. And the really important message I want to get out there, not just to women but to doctors, is that not all women get hot flushes, and hot flushes are not the only symptom of menopause. Many doctors seem to think that if you don't have hot flushes, you don't have perimenopausal symptoms, and that's just simply not true. So here we go. I'm going to divide them up to start with into physical symptoms, mental health or psychological symptoms, and when I say psychological, I don't mean that they're imagined symptoms, I mean that they are affecting our psychology, and the hidden symptoms, and I'll explain more in a second. So let's start with the hidden symptoms, because these are the things that are affected by losing estrogen around menopause and perimenopause, but you don't know it's going on until it's too late. So if you know at the start, then you can make decisions about treatment. So after the age of 50 or 51 in the UK, which is the average age of menopause, women start to get affected by the loss of estrogen that happens around that time in ways that they don't necessarily know. So for example, women only get their heart disease in the main, and obviously there are exceptions to this rule, but women naturally get their heart disease after the menopause when they've lost estrogen. And that happens over about a 10 to 15 year period when the heart starts to get affected by the way that we metabolize fats and cholesterol and build up lipid deposits, atheroscleroma, in our arteries. So that's going on quietly behind the scenes, and it's a big, obviously, issue because it's our heart. So there are things that you can do about that, and we'll talk about that later. I'm not going to go into treatment in a major way, but it's something to consider. Women get their heart disease after the menopause, but it's hidden. You don't know about it until it's too late. The same with bones. After menopause, bone density, so that's how thick and heavy our bones are, and in thick and heavy we mean resistant to fractures. After the menopause, our bone density declines rapidly, much more rapidly than before the menopause. This is extra important if you have an early menopause or premature ovarian insufficiency. So if those things happen at an earlier age, quite often in a woman's 30s, then your bones are really going to take the strain if time goes on, if you don't treat it. So osteoporosis is a symptom of that bone thinning, and it's women who are at risk of breaking bones in osteoporosis, and a hip fracture is devastating. You know, almost a third of women who break a hip will not survive a year, and that's staggering if you think about that. Another third will never live independently again. You know, this is big disability. So bone density is really important. And again, I'll talk about what you can do about bone density later, but it's important to know that after your menopause, left alone, your bones will be thinning. And then of course there's the brain. So the brain is scattered with estrogen receptors, and when you lose your estrogen, those receptors no longer get stimulated by estrogen. And there is a theory that what happens then is some of the brain cells around those receptors die as well because they're not getting the stimulation that they need. And there's a question mark at the moment and lots of research going on about whether or not that is one of the contributing factors to Alzheimer's and dementia. So looking after your brain after menopause is also really important. And there are, again, things that we can do about it and lots of things that we can't, because estrogen obviously is being lost, and unless you replace that, that's not going to change. So those are what I call the hidden symptoms of menopause: bone, brain and heart slowly actually deteriorating after menopause, and there are things that we can do about it, so don't despair. So now let's talk about the physical, and this is a long list. So I've tried to group the symptoms in this into different groups that are kind of associated. So of course we have got hot flushes and cold flushes as well. Women go hot and cold, they have hot flushes, they have night sweats. So the hot flushes are when you're overwhelmed by heat. Out in the middle of the day, no warning, you can go red and blotchy, you can feel sweaty, or you might not have any visible signs but you're still overwhelmed by this heat and you want to strip off all your clothing, and you look around the room and nobody else in the room appears to be suffering in the same way as you. And that's really common. Night sweats, so this is when you wake up in the night and you are drenched. And I hear stories of women having to change their night clothes, their sheets, can't tolerate a duvet on them, can't tolerate having someone else sleep with them or cuddle them because it's just unbearable. So those are night sweats. Insomnia, and I've grouped that in here because quite often those hot flushes and night sweats actually create the insomnia, because 1 minute you're boiling and you throw the duvet off, and then 2 minutes later you're cold and so you pull the duvet on. But obviously to be doing that you're actually awake or semi-awake, so sleep quality really gets interrupted. But it's not just those things that interrupt sleep quality. Women get insomnia at menopause and after menopause. And don't forget that perimenopause, the time leading up to when your periods stop, can go on for 10 years. So this can go on for a long time. Fatigue. And fatigue is a symptom on its own of menopause. So women can feel absolutely drained, unable to do anything. And that can just be because of menopause. But obviously, if you're not sleeping and your sleep is interrupted all night, then that's going to make that worse or create fatigue on its own. So that's why I've grouped all of those together. And those are called the Vasomotor symptoms. But as I said earlier, even if you don't have those, doesn't matter, doesn't mean you haven't got menopause if you've got some of the others. So the next thing I'm going to talk about is your vagina. And this is really, really important. And there is a vlog coming on this in the coming weeks, a really great one, but I won't give anything away right now. So a dry vagina happens in menopause because the mucous membranes that are stimulated by estrogen no longer produce the mucus that lubricates the vagina. So all sorts of things can become painful and difficult. Just walking and sitting to start with, because all of the tissue is chafing and sticking together. Having sex, using a tampon, because you might still be having periods. Just because you've got periods doesn't mean you're not perimenopausal. Having a smear test, and I've spoken about this before, having a speculum put into your vagina to examine you can be excruciatingly painful because of this dryness. And because of this dryness, women get urine infections more often than they used to. So if you've got urine infections all of a sudden, all of the time, and you never used to get them, this is something new for you, it's worthwhile looking at whether or not this is being caused by vaginal dryness as a perimenopausal symptom. Women also start to feel that they've got a urine infection when they don't, when their urine tests negative for bacteria, but they constantly feel like they've got cystitis-like symptoms, dragging feeling down below, a burning sensation when they pee, needing to pee more often, small amounts. And this really, again, is an under-recognised and under-treated symptom of menopause. I hear too many women going to see urologists, urogynecologists, and having cystoscopies and biopsies and meatal dilatation when none of these things are necessary. This is very easily treated with vaginal estrogen. Now, I say easily, it's not easy for all women, and some women need more than just vaginal estrogen, but it certainly is a help. Irritable bladder can be caused by perimenopause, so a feeling that you're needing to go to the toilet all of the time, you're rushing off to the loo all the time, getting up in the night 10 times. That's a perimenopausal symptom for some women. And with that, sometimes comes incontinence, because pelvic floor issues certainly get worse after menopause, when the ligaments and the tendons lose all of their estrogen and their elasticity, and they just stretch, and you can no longer tighten them like you used to. So pelvic floor exercises continue to be very, very important, but also it becomes more difficult because it's being caused by the loss of estrogen. So prolapses become more common around perimenopause, and that's prolapses of the uterus into the vagina, the bladder into the vaginal walls, or the bowel through the vaginal walls. And all of those become more common as everything becomes drier and more dried out and mucus disappears. So these are all issues that sit together with vaginal dryness, and obviously at the end of that, vaginal atrophy, and that's where, because of the lack of mucus, everything shrivels really, and the skin becomes much thinner and more delicate, and everything sort of moves around, and that's why you're more at risk of urine infections, but you're then also more at risk of chafing and thrush, and women bleed because the tissue becomes so painful and so sore. So these are really serious issues around perimenopause and menopause, and unless treated will go on for life and will get worse. So we'll talk about the treatment later. So on to another group of symptoms now that involve the head really. So I often hear women telling me about dizziness and vertigo. So dizziness where they feel like they're swaying on a ship, and vertigo where they feel the room is spinning. Alongside that, headaches or migraines can become much worse than they ever used to be, or they can start. So women who used to have migraines quite mildly suddenly get them really severely, or women that have never had migraine before suddenly find them appearing. So, and that's really common, and that happens a lot, and we talk about that an awful lot. And tinnitus, which is a ringing in your ears where you can't hear anything else but this ringing, which then also feeds into insomnia, because it's really hard to sleep when you've got this buzzing or ringing in your ears constantly, which isn't generated outside of your head, it's generated inside. So that's really hard as well. All of those things get worse or can get worse around menopause and can be treated, but we'll talk about that too. All of the treatment I'll put at the end. Skin. Skin becomes dry in perimenopause and menopause, really dry. And with that it can become very itchy, but there are kind of two kinds of itchiness. So there's the itchiness that you get just from being very, very dry, and you can just be itching all over, and I've seen women ripping their skin apart with that itchiness of menopause. But also women described having insects crawling under their skin, and that's called formication, and that's really common in perimenopause as well. So please don't think you're going crazy. Feeling that itchiness under the skin that feels like things are moving and running around under your skin, really common. Then there's weight gain. Now women often say to me, oh, I don't want to go on HRT because I don't want to gain weight. It's not the HRT that's causing your weight gain, it's menopause, perimenopause. It's our friend called the menopause. So what happens in menopause is we start to lay down fat in a different way. So we collect it around our tummy and midriff. We start to handle fats differently. So there's a physiological change in the cells of your body in the way that they handle fat. We also need less because our metabolism slows as we get older. So those are the things that make you gain weight, I'm afraid. Women often describe digestive issues, feeling bloated, feeling full. Now, whilst this can be a perimenopause symptom, don't just assume that. Any woman over 40 that suddenly feels bloated or getting full up to too soon or having issues with food, please see your GP just in case it's something else, and that's really important. It's easy to assume, but always better not to. Now, hair. This is a really interesting one. Women certainly find hair thinning around perimenopause and menopause, and hair loss is really common and a really distressing complaint. But at the same time, women can get hair growth, facial hair, so more hair around the chin and moustache area, and that can also be equally distressing. So on the one hand you're losing hair, but on the other hand you're growing it. Hair can become very dry, and that certainly happens, and I see that all the time. And at the same time, nails become very dry and brittle, and it's quite a good indicator that things are changing. And I think dryness is a word that is associated with menopause in so many ways, and it will come up again just now. So you've got vaginal dryness, you've got your hair and your skin, and there are other areas too that are affected by this dryness. So essentially mucus is not being produced in the same way that it used to be. Then of course there's muscle and joint pain, and that's a really common one. I see that all of the time. Just women finding that they're aching all over, in joints all over. It's not just one or two, it's shoulders, elbows, knees, hips. Now of course, as we get older, we do get more joint pain because we get osteoarthritis. So it's a combination of both, but it's primarily caused because estrogen actually keeps our tendons and ligaments nice and moisturised and lax and able to move better, and it actually plumps up our cartilage, which keeps our bones apart. You lose estrogen, you lose all of that, and all of those tendons and ligaments become dry and things start to ache and hurt. Breast tenderness. Now it can be really common, and that's the hormones fluctuating as they change, because one minute you'll have loads of hormones and periods and everything's going swimmingly, and then they'll plunge and you'll miss a few periods, but then they'll come back and start again. So it's those swings in hormones. When you go from no hormones to suddenly producing them again, you can get breast tenderness, and this can also cause that bloating we spoke about. And women often find that their periods get heavier and closer together, and they can start flooding. So yes, that is a very perimenopausal symptom, but again, always worthwhile getting those kind of things checked out by your doctor to make sure it's not something else. Now, on that note, palpitations are really common, and I'm going to talk about the mental health issues later, and I think sometimes palpitations are being caused by some of the mental health issues, but they're also being caused by hormonal changes again. But it's your heart, so again, don't just assume that palpitations are being caused by perimenopause symptoms. Please see your GP. But yes, it is a symptom that we hear about lots. Now, you remember I mentioned the dryness. Well, there's more. So dry eyes are really common, and again, it's just mucus not being produced in the way it was, and it happens as we get older, and it happens at menopause, along with a dry mouth and a dry tongue. So as I've said, it's all the way through the body. Things start to dry up when you lose estrogen, and dry eyes and dry mouth are also very common. There are some solutions. And then acne. So women that have never had acne before, or used to get it in their teen years, suddenly present with it again. And again, it's hormone swings. It's when you're going from high to low and then back up to high. And hopefully as you get through it, that should get better. Or if you treat it, that should get better. So now we come on to the mental health issues. And I've grouped all of these together, but I would say as a doctor, treating menopause often, that I think the mental health issues are some of the earliest signs of perimenopause, long before periods have even started to change, long before there are any other symptoms, and I think it's the most undiagnosed and unrecognised symptom of perimenopause. And this is where women get given antidepressants and they don't need them. They need hormone replacement therapy, or just to understand what's going on so that they can take a different approach. So the kind of things we see are low mood and anger outbursts, suddenly being cross at the drop of a hat at things that would never have made you cross before. Being tearful all the time and not understanding why. Being really anxious and irritable, and this is where I think The anxiety can drive the palpitations. And of course, all of these things can drive the insomnia. So all of these symptoms are interlinked and feed each other and make things worse. Depression is really common. And if you see a woman who's gone through life as happy as anything, never had any depression or anxiety, and suddenly that's what she's presenting with, as per the nice guidance, doctors, please don't treat her as a depressed woman and give her antidepressants. Treat her as a menopausal, perimenopausal woman and treat her accordingly. Loss of libido, really common. Does happen in depression. Probably linked with all sorts of things. If you've got a very dry vagina that's too painful to go near, you're going to lose your libido. If you're depressed or anxious, you're going to lose your libido. If you're putting on weight and don't feel attractive anymore, you're going to lose your libido. So all of these things are so interrelated, and it's a complex interaction of lots and lots of symptoms. Poor concentration is really common. And having a lack of focus and inability to concentrate, that's really common. Women say, I just can't think anymore. I put the keys into the freezer and the baby in the microwave. No, don't do that. But I'm joking aside, it's a really common, really difficult issue because these women are working, they're carers, they're mothers, they're partners. You know, being able to focus, concentrate and get things done is really important. So that's another really common issue that I hear. Sorry about that. That's my air freshener. So lack of focus, as I've said, lack of concentration, and then low self-esteem. And is it any surprise? Life is changing dramatically. We're feeling rubbish. We've got aching bones, dry vaginas. We can't concentrate. Our hair is falling out. Our eyes are dry. Our mouth is dry, you know, and so on. Is it any wonder that we have a loss of self-esteem? And I think that's to be expected. And what we need to do is we need to make menopause a subject that we can talk about over the dinner table. So really important that we create an environment where women can actually feel confident enough to talk about their issues, share it with other people, not feel ashamed, and feel supported by everyone around them, be that in the workplace, at home, in the park, wherever, and therefore not actually lose their self-esteem, but actually work out a way for them, individual to them, to deal with their issues and go forward in a positive and confident manner. Really, really important. Because otherwise, the whole mental health thing cascades, and as is typical in all sorts of depression and anxiety, people lose their lack of motivation and they lose their lack of joy in life. They have nothing to look forward to in the future. And actually, we can overcome that because there are solutions, and I think getting it out there and talking about them is one of those solutions. So, those are the symptoms of menopause and perimenopause, and I'm sure I've missed some. Please correct me afterwards if I have, and I'll be happy to talk about them, but there's a few to be getting on with there. So what can you do about it? Well, I think for every woman, the most important approach to anything in life, but especially perimenopause and menopause, is healthy living. So it's a healthy lifestyle, stopping smoking if you're smoking, maintaining a healthy BMI and weight, so that's between 18.5 and 25. Learning to actually cope with the symptoms that you've got if you're not treating it in other ways or it's not being treated properly. So light clothing that actually doesn't make you feel like you're suffocating and you can't cope with the hot flushes. Regular exercise. I can't stress enough how important that is for everything, for longevity, for weight control, for mental health issues, for joints and muscles, and actually just enjoyment. And it might not be enjoyable at first, but eventually you'll enjoy it, I promise. And relaxation, so yoga, acupuncture, mindfulness, all of those things combined are really important before you think about anything else. Then there are lots of natural remedies for menopause. Now, I have to say at the outset that there is almost no evidence for any of this. Most of the evidence suggests that when these things work, they work by placebo. That's fine. If they're working by placebo, who cares? If it's working for you, then it's brilliant. So the kind of things are pine bark, which is supposed to treat all symptoms, but particularly hot flushes. Sage, which I've been told by women does work for hot flushes. St John's wort seems to work for sleep. You have to be careful with St John's wort, what you mix it with in terms of other medication, and you have to be careful of your eyes and the sun. Magnesium, which works for a lot of women for leg cramps if they get them and for sleep. Black cohosh, which may work for hot flushes. There's not brilliant evidence, but it may. Acupuncture. Definitely there is a role for acupuncture, and there is some evidence that it reduces the severity of hot flushes. It doesn't stop them, but it reduces the severity to a level where women feel that they can actually deal with them, which is great. Even in primrose oil for hot flushes, the evidence says it doesn't work, but the evidence also says it doesn't work for breast tenderness, and certainly for me, in my younger years when I used to get that monthly with my cycle, it worked brilliantly. So it's there. Soy seems to work for flushes, and certainly in countries where they eat lots of soy, like Japan, they don't even have a word for menopause. So who knows whether that's cultural or because they don't get flushes. Folic acid apparently can work for hot flushes. Eating fish, drinking red wine is supposed to lower the chance of an early menopause, but having said that, you have to weigh that up against other risks. Not eating fish is brilliant. I'm almost a pescatarian, almost, just by naturally. Red wine, however, we know that drinking 1 glass of wine a night increases your risk of breast cancer by about 5 cases per 1,000 over 5 years. So just worth weighing up the pros and cons always of all of these things. Having a low-fat dairy diet, so lots of dairy but low fat, reduces your chance of an early menopause and delays the onset of symptoms. And we think that's because low-fat dairy actually has more estrogen promoting elements to it, and that's why that works. Antidepressants. Now I know earlier I said no, but there is a role for antidepressants. They do work for hot flushes. What I don't agree with is seeing women having antidepressants for their depression, which is purely menopause, because it won't work because of what's causing it. But for hot flushes it can work, and it can work quite well. And it can work for anxiety. Tibolone, which is an estrogen receptor modulator, so it encourages your body to make its own estrogen, testosterone and progesterone. That can work. Clonidine is a blood pressure pill which can work for hot flushes, and I know there are people who say it does work very well. I don't think it does work brilliantly for most women, but for some it does. And it's about finding what works for you. More and more women now are using gabapentin, which is a nerve painkiller. However, that is now a controlled drug, so you will have to talk carefully to your GP if you want to try that. Then, of course, we have HRT, estrogen, testosterone and progesterone. So we know that HRT under the age of 60 actually is life-preserving. It keeps your bones strong and it builds bones. It protects your heart against the heart disease, and it protects your brain. Testosterone can help with libido, energy, and muscle pain, but testosterone is a second line HRT remedy. For 90% of women, just having HRT will sort all of those things out. And then of course let's not forget vaginal estrogen, because it's crucial in treating vaginal dryness and atrophy. And you do have to use it sometimes with vaginal moisturisers like Yes, but it is a brilliant treatment, and there is almost no systemic absorption, so you can use it lifelong. You don't need to protect the uterus if you're using it just as a standalone treatment. You do if you're using oral HRT, obviously, but there are solutions which work, and HRT plus vaginal estrogen are very good solutions to all of the problems, with lots of health benefits, certainly under the age of 60. So, it's a lot to take in, and I don't think it is a short vlog after all. There are more than 40 different symptoms of perimenopause and menopause. You can have one or you can have all 40 or a combination of them, and no woman is the same, which is why an HRT treatment program has to be individualised to the woman. There is a massive crossover of menopausal symptoms with thyroid condition symptoms, really similar. So always get your thyroid checked. You don't need bloods for hormones if you're over 45, because They fluctuate all of the time. You just need symptoms. So if you've got symptoms and you're over 45, your doctor should treat you. But always, if there's any doubt, have a thyroid test just to make sure your thyroid's working okay. Because thyroid can affect periods all the way through to the temperature you feel, your sleep, your hair, everything. It runs everything. It's like the petrol in the car. So I'm going to put a link in the description to a symptom checker, and hopefully you can print that off or go to the link and print it off and take it to your doctor with you so that you can say, well, actually these are my symptoms. And I think that's really important. And I hope the whistle stop tour of the 40 plus symptoms of menopause has been helpful. Please don't hesitate to ask me questions in the description below this vlog, and I will always answer them. You'll see on my other vlogs, I answer quickly as well. And if you've got any suggestions for me to do other vlogs in the future, please pop those there as well, and I will do them for you. Because I can think of a million topics, but sometimes they're things that people want covered, and I'll cover them. Thank you for watching as always. It's really appreciated as ever, and I'll see you soon.